I started my WomenLift journey with aspirations to explore new intellectual waters. I was passionate about pursuing many ideas, at one point selecting a second leadership topic and momentarily thinking I might be able to deliver on both. I was energized by the institutional access these projects would unlock, the findings I might contribute to the field, and the opportunities that could unfold. What did unfold was not interrogation of the hypotheses that had me so excited, but rather an immersive study of a topic I had been trying to quietly navigate behind the scenes: the influence of caregiving responsibilities on women's leadership. The greatest determinant to my own leadership potential has been a struggle against quicksand, gradually pulling me under the surface. My name is Brooke Cutler. I'm a consultant focused on the intersection of gender equity and global health, and for the last 7 years, I've been sandwiched. Members of the sandwich generation are described as experiencing generational overlap, squeezed between dependent care, the care of aging parents, and generally also juggling participation in the formal workforce. But the word generation is a misnomer. While most of those who are sandwiched are between the ages of 35 and 50, this group is defined not by age, but by the scope of their caregiving duties. A person may also experience multiple peaks of sandwich in their lifetime. Their caretaking experiences cannot be typified. Each is a mixed bag with a linear, more predictable trajectory for children and an episodic and downward progression for their elders. While the detriments of caregiving are increasingly being documented, including diminished mental and physical health, financial security, career prospects, and overall well-being, the complex dynamics of those outcomes for the sandwiched are not as well studied. Given the three-dimensional profile of this group, dependent care, elder care, and professional work, we might expect this grim data on well-being to only be amplified for this population. What data we can access confirms that it isn't easy. It also comes largely from Europe and North America, from wealthy nations, places with formal, albeit broken, welfare systems. This focus on the global north has shaped the way we think about the consequences of intergenerational transfer. And it means we lack a comprehensive understanding of the magnitude, determinants, or impact of the sandwich experience. These individuals are subsidizing entire economies, yet their heavy labor is invisible. What we do know is that those in the global south are more likely to experience sandwichness and will spend longer periods of time in that position. Those in sub-Saharan Africa will also experience a shorter period of respite between the double peaks of sandwichness and grand sandwichness. But the dearth of knowledge beyond what is suggested by these projections is deeply problematic. Gender equity and leadership depends on understanding the dynamics of generational caregiving beyond the research agendas of specific disease verticals and across the full life course. Leadership is not a point in time. A promotion to lead an organization is not in and of itself leadership. Leadership is what happens when that individual is sustained in the role and positioned for new opportunities, making room for others to achieve. If we're not addressing the varied life course of our caregiving journey, then we are neglecting critical inflection points for sustained impact. Current momentum to measure unpaid work and the global care economy is recognition that this matters. But we're missing vital information on the regional characteristics of generational overlap. If outcomes related to well-being from the global north are any benchmark, I would hypothesize that the global health community is by and large blind to the forces behind one of the single greatest determinants to scaling women's leadership and achieving gender equity. My WomenLift Health leadership promise is to act on the complexity of what the last 7 years has taught me. Instead of seeking my former status quo, I will instead value lived experience in my colleagues, understanding that workplace culture and professional expectations may drive them to silently bear their duties out of view. Reframe the act of caregiving not as a burden to bear by employer or employee, but as a labor of love, one that lends leadership skills to the workplace. Acknowledge that choosing to caregive is for many a false dichotomy. Caregiving can both be a choice one makes and also the only option available. Most importantly, I will advocate for building novel systems from the ground up that reflect the profile of the workforce now, versus simply adapting anachronistic structures designed for a fraction of the population. I will approach caregiving for what it is, a public health issue, a social determinant to health, and moreover, one of the most vital levers to women's leadership that we can influence. Thank you.